Hi everyone, I am Dr. Suraj Rania, hematologist and BMT physician. Today we will discuss what are treatment options available for myelodysplastic syndrome. What is myelodysplastic syndrome and what are types we discuss in first video. The link is shared below. While what are symptoms and diagnosis of myelodysplastic syndrome we have discussed in second video. The link is shared below. Today we will discuss treatment options. Though the treatment options in myelodysplastic syndrome, it depends on whether you are symptomatic or asymptomatic and you are low risk category or high risk category. Usual general recommendation for management of MDS involves supportive care. Supportive care usually involves transfusion of red blood cells and platelets when they fall below the critical levels and they become symptomatic. It also includes giving a growth factor to boost your WBC count and thrombopoietin agonist such as L-Thrombopag or romiprostin to boost your platelet counts. It also involves giving recombinant erythropoietin agents such as darbepoetin 1 in 2 weeks or 3 weeks depending on the your hemoglobin count. Second, it also involves supportive care involves giving the vaccinations at regular intervals such as flu vaccine yearly and pneumococcal vaccines every 5 yearly. The vaccine we usually recommended are the inactivated vaccines. Different vaccines has a different effect in myelodysplastic syndrome depending on their immunity, because they some myelodysplastic have a normal WBC or some myelodysplastic syndrome have a abnormal or low WBC. So treatment response vary from person to person. Second treatment involves low intensity therapy. Low intensity therapy usually is recommended for low risk patients. This low intensity chemotherapy usually involves giving hypomethylating agents such as azacitidine and decitabine or few medicines in specific situation. First situation is deletion 5q syndrome. In deletion 5q syndrome, 70% of people respond to a medicine that is immunomodulatory agents called as lenalidomide. So it is highly effective medicines. So these medicines improve the red blood cell count in almost more than 70% of the people. In hypoplastic MDS, where along with the dysplasia there is a along with defect in formation there are decrease in cellularity also. This we called as a hypoplastic MDS. In this condition, immunosuppressive agents such as antithymocyte globulin, cyclosporin can also helps. These are the special scenarios where along with the low intensity chemotherapy this can be tackled with lenalidomide and ATG. Coming to a third management in high risk MDS. In high risk MDS, it requires intensive chemotherapy such as we usually give in acute myeloid leukemias. Usually we recommend this type of therapy followed by transplantation in people which are younger than 65 years. Usually more than 65 years we recommend low intensity chemotherapies and supportive care, because these people may not able to tolerate the high intensity chemotherapy and transplantation. The age is not absolute. We have to assess people according to their comorbidity index, because some people may be older but they are physically fit and they might not have comorbidity, while some people which are younger can have a different comorbidity and different level of fitness. So we have to judge this patient objectively by doing various comorbidity index to choose the best treatment option available. So in brief, the treatment options are supportive care by giving blood and some growth factors. Second, low intensity chemotherapy for low risk MDS or people with high risk MDS which are above 65 years of age broadly. Third is high intensity chemotherapy followed by transplantation in high risk category patients with age less than 65 years, or these are perfectly healthy fit people. That's all for today's video of discussion. Until next, stay informed, stay tuned, stay healthy. Thank you.